Okay. Thank you, Kaiti. Good evening, everyone. Pleasure that you are all here, and thank you, Dr. Kaushik, for joining us. Dr. Somesh N. Kaushik is an Ayurvedic and naturopathic doctor with over 30 years experience as an Ayurvedic physician. Dr. Kaushik medical training is extensive. He is one of the most experienced Ayurvedic physician in North America and is the recipient of the Dhanavantri Award, his professional honor. Dr. Kaushik lectures on Ayurvedic medicines at the Institute of Naturopathic Medicine, Portland, as well as at various national and international symposium and events. And, today, he's going to lecture us about, as all of you know, about COVID-19. And this pandemic has raised a lot of anxiety and a lot of question. Dr. Kaushik is going to talk about all the opportunity to raise awareness and the shift in perspective to change worry and fear into care and compassion, panic into prudence, quarantine into retreat. It's a great pleasure to present Dr. Kaushik. Thank you.
Good evening. Everyone is concerned about one thing at this point, the coronavirus. That has become the topic for household, outside, work, national, international level. Everyone is talking about the coronavirus. So what is coronavirus? We would like to know the virus itself, where it has come from, a little bit about the structure and how it works. But those things you have already known enough because there's so much discussion about the COVID-19 on coronavirus in the news, in the newspapers, everything you study nowadays and read nowadays is all about coronavirus. But our main discussion would be about prevention, how we will prevent ourselves and our close circle of friends, relatives, or families from getting infected, and how we will, if someone get infected, what can be done about it. So what is COVID-19? COVID-19, as we know, is the coronavirus of 2019, or coronavirus disease of 2019. It is one of the coronaviruses, also known as SARS-CoV-2, is a large group of viruses that cause illness in humans and animals. And this is a zoonotic transmitted disease. So any disease which can be transmitted from animals to humans is a zoonotic disease. The only problem is that the animals are known to this virus or disease, whereas this is something new for the humans. And that's what we call the novel disease. So our own system, the human system, is not able to recognize it and is not able to fight against it. And that makes it a problem. And that's why it is very difficult to control not only the spread, but also to find a treatment. So in this case, when we're looking at the coronavirus or COVID-19, then you also like to know that how this is spread and how it's basically transmitted. It's a family of viruses. They also cause multiple conditions. Again, it has known to us for many years now. The most common cold, which we see, again, common cold is the single disease or condition which is affecting the largest population around the world every year. We see that. After that, we have seen the most common was SARS, severe acute respiratory syndrome, which happened from 2002 to 2003. Then it came as MERS or MERS, Middle East Respiratory Syndrome, which came from 2012 to 2015. And now we are looking at the COVID-19. So all of these were coronaviruses. So let's talk about briefly, how did it start? In December 2019, the virus came from a seafood or poultry market, or basically a place in China, Wuhan, China. And From there, it's believed that it did spread all over the world. There has been many speculations about which animal might have been initially. Again, concerned of that, there's no, I mean, even though we are talking about different animals, but again, there's no confirmation. It's only speculations. So let's look at the structure. Corona means crown. So this is a virus, have a crown-like structure around it. And that crown-like structure also, again, these also have an envelope, which will make it possible for the virus to stick to any structure easily. Also allows the virus to be killed by disinfectants. So in this case, there are pros and cons, at least because of this crown, it is easily killed if it is in direct contact with a disinfectant. Why so dangerous? Screen. COVID-19 is most contagious than other coronaviruses due to its being new to our immune systems. Like I said before, this is a novel virus and our immune system does not recognize this. And because the immune system does not recognize this virus, it's difficult to kill, and it has become very contagious. As soon as it goes inside the system, it spreads fast, and our system is not able to fight because it takes time for the system to know what is inside me. Causes more cellular damage than any other viruses, produces more inflammatory cell. So basically inflammation is again the most common condition when we have any disease. Anyone that is immunocompromised due to prior conditions or medications or aging is also more at risk. Can be transmitted from carriers, even the asymptomatic one, rapidly. So people who are already infected, and if they come into close contact with you or any other individual, then we get the infection. The issue is that closer the person is or closer the source is, higher the concentration of the virus is in their cough or sneeze, and in that case, it becomes more contagious. So if you are farther away, so basically what we are hearing every day, 6 feet has become a standard. But again, people who are even 6 feet, they still have the concentration. It has been measured up to 13 feet. The virus was found in the closed air. So farther you are, better it is. And that's why the personal protective equipment is very, very important, which is most commonly is the mask. So let's look at the seasonal flu, which we see every year, and COVID-19, and compare these both together. COVID-19 is caused by one virus transmitted through air, which is airborne. At this point, no known medication. And there are about 3 million or over 3 million cases already worldwide infected with COVID-19. Whereas when we see the seasonal flu or common cold caused by several strains of influenza virus, which changes every year, transmission person to person through sneezing, coughing, or talking. Medications are available because every year when there's a new strain, we're able to find a medication or vaccine which is helping. And this affects almost a billion cases, a billion individuals worldwide every year. So when you're looking at these both, and especially at this point where there's a flu season also starting, on top of that, the pollens are also starting. And there are many individuals, especially in the Northeast, who are affected by the pollens every year. It's hard to find if you have the common cold, just the flu, or the pollens or the COVID-19, because symptoms are overlapping. So we're seeing most commonly fever, cough, shortness of breath, fatigue, and both of these are preventable if we take care of ourselves and again keep the distance and also make sure we use the mask. one thing here missing actually in the COVID-19, which sometimes we as humans don't recognize and are also in many places went unrecognized, is the GI issues. So gut is also affected. And there have been studies in China where they found that many individuals who came with the shortness of breath or fatigue or fever, one thing majority of them had was underlying other one more cause, which was their gut issues. Digestive issues, either had diarrhea or something else or malaise. But again, those were conditions which were ignored because most of the time we think, oh, it's just the gut. When we get concerned, when things come to the vital organs, when we can't breathe or when the heart is skipping or something. So in that case, what we need to be concerned about, even though it could be just the gut, it is not just the gut, it is something else, or possibly it could be something else. Now we're looking at the SARS and COVID-19. There are similarities. Again, fever is the most common symptom reported. Cough, fatigue, malaise. Again, they are airborne, may lead to respiratory distress, and because of that, the ventilation is needed in both. Affects the immunocompromised people first, so anyone who comes in the category before aging or any disease, or if they are diabetic or have heart condition, hypertension, or kidney problems, anybody who have, or people who have basically chronic asthma, anyone who have issue which makes it difficult for them to breathe normally anyway, they are also at higher risk. People who work with chemicals, so chemical sensitivity found to be also one of the things which makes our lungs weak. People who use a lot of strong chemicals in the home cleaning and work in factories and plants and work which use a lot of chemicals, their lungs become weak because they keep inhaling those chemicals every day. And in both of those, there's no specific treatment available at this point. We look at the differences of both. COVID-19 had runny nose, the most common symptom reported. Sore throat is also the most common. Nausea, less than 15% of patients require mechanical ventilation, and the mortality rate is between 0.25 to 3%. Transmission is much quicker than SARS, and that becomes also an issue when it spreads very fast. One more thing is anyone who requires ventilation actually is really serious, and there have been some reports and news coming out that the basically mortality rate is 75 to 80% in those who require ventilation. But again, ventilation comes at a point where a person is not able to breathe by himself or herself normally. SARS starts with chills, headache is very common. It was found, it originated in bats, and from bats went to civet cats, and then from there it was transmitted to humans. 20 to 30% of patients required mechanical ventilation, and mortality rate was much higher than the COVID-19, which is 10%. So it means this is much deadlier condition than the COVID-19. Symptoms. So now let's look at the COVID-19, what we are seeing most commonly in COVID-19 cases. The most common report is fever. So when someone have high fever, that is the first concern. And also anytime you have fever, we do see tiredness, fatigue, because when the temperature goes high, there are many organs or working in the body to prevent. It means there is some kind of infection, there is something inside the body, and body raises temperature to fight against it. And also dry cough is reported. The less common is the malaise, nasal congestion, runny nose, sore throat, and diarrhea. So diarrhea, even though is less, but again, there had been many reports which said that people did have the digestive issues started the first, but they kept ignoring it for longest period of time until the virus got embedded into the lungs and they were having difficulty in breathing. Symptoms may show 5 to 6 days to up to 2 weeks after initial infection. Some people are asymptomatic, so they are the carriers, they carry the virus inside them and keep infecting other people knowingly and unknowingly. If you have encountered anyone with a confirmed diagnosis, you must self-isolate for a minimum 2 weeks. And that has shown to be the number one factor to minimize the spread of the disease or the virus where you are away from individuals, which we are now knowing as the social isolation or basically distancing. Farther you are, better it is for yourself and also for others. The risk factor at this point, again, anything which is making our immune system little weak. Advanced age, older the individual is, we're finding their immune system is little weaker. Again, that may or may not be true in many cases. We have seen some individuals who are in 16, 17, 80s have much stronger and better health than a lot of young ones who could be in their 30s. And because from childhood they have been taking a medication or a sport or pump for breathing, it means they had asthma or other issues or diabetics, their immune system is much weaker or compromised because of their disease. So age, again, just a common factor. We just think that people who are older and many of them are not taking care of themselves. And if by that time they have other conditions started, then that will make a risk factor. Immunocompromised state, and that comes with a severe disease or a condition. Many times it is induced because the treatment requires a drug to suppress the immune system. At that point, people who, for example, had any kind of cancer, to make sure the medicine work, the treatment work, their own immune system is suppressed, and that has become an issue at this time. Individuals with diabetes, and diabetes is a multi-organ condition. In that case, also they are at a very high risk with this virus. Cardiovascular disease, individuals with hypertension, which are millions and millions of people. Chronic pulmonary disease should be actually at the top, because if you are not able to breathe and your lungs are already have inflammation, also already weak, then this becomes a port of entry where from nose, nasal passageway, it comes to throat, and from throat easily goes to the lungs where it spreads fast. Liver disease, malignancy, and severe obesity. So basically people who are severely obese or very high weight, they have the issues to fight, because with the weight, it brings many other conditions. For example, if their circulation is compromised, their metabolism is compromised, their temperature is low. So it brings many other conditions. Again, most of the people who are already obese also have issue with the blood sugar imbalance. So diabetes is also very common in those individuals. Arthritis, all these things. Basically, anything which causes inflammation inside, that will also put person at a higher risk compared to a person who is healthy and have no inflammation. So even though at this point, when we are looking at the disease itself, we didn't spend much time. And again, we also have a limited amount of time to talk about the virus. So we have heard a lot more about the virus in the news and from all over the world. Any news channel you open is already, everybody's talking about the virus. So there was no need to go into the depth of the virus. So now we need to know what can be done, because that is the question. And that's what we're looking for. So even though one thing I like to mention here, there is no treatment available. Anything I discuss here is not a claim that basically this is going to be a treatment, even though many people do feel better with what we offer. Many people who were infected are free. But again, I'd like to put a disclaimer that basically there's no known treatment at this point in this country. So we are using precautions. Social distancing have been the number one. Basically, you stay away 6 feet. We have seen many stores where they will put limited number of people inside the store so that it is not crowded. And also we have seen marks in many stores. You stay distance 6 feet between individual who is in front of you. Cover your coughs and sneezes, because closer you are, the virus in the cough or the sneeze closer to the individual is much higher. So as you move farther, then the concentration is much lower. So you're saving and protecting others. And also the personal protective equipment, again, mask is the most common. And again, in some cases, you may also need gloves. And healthcare workers also have this cover on their body. So basically, it's very important that you carry some kind of mask, even though the mask which was in the beginning, the N95 were introduced, became difficult to find. And so now even if you're using a homemade mask, just a scarf, something to cover will be helpful. Even though, as we know, the size of the virus is so small, it can penetrate if the cough or the sneeze is faster. But again, whatever helps, we should do that the most. Next thing we should do as a precaution is boost our immune system. And this is the one we will talk about the most, because if nothing is working, then whatever is given to us by nature, why not build upon that and make it stronger? And also the lifestyle changes, which is diet and our exercises. So keeping that in mind, some precautions, which are basically just precautions: social distancing, covering ourselves, the using mask and personal protective equipment, the common sense, actually the hygiene, personal hygiene, washing your hands. If you touch something, you wash your hand. I've seen many individuals, and also again people working in the healthcare field, end of the day they take their mask off, and since they had this mask on their face for so long, they feel irritation and itchiness. And as soon as mask is over, they start rubbing their nose and rubbing their face where the mask was there, and that defeats the purpose. So make sure you don't touch your nose, don't touch any part unless you have washed your hands. And again, including us, we work with the patients every day. First thing is, as soon as you come home, you take a good shower with hot water, change your clothes, and then enter the home, and then you touch and deal with other family members. Otherwise, could be a risk of bringing the virus from outside, because the virus can stay on surfaces for up to 72 hours or 3 days. So in this case, we want to make sure that we don't, when we touch something outside, even the shopping carts, make sure we use the disinfectant wipes, which a lot of stores are providing. And when you come home at your grocery or something you bring, wash and clean, and then start using that. So precautions are very important. So sportive care, even though you can call it some kind of things to prevent yourself, but I practice Ayurvedic medicine and naturopathy. So we will be building upon the principles of Ayurveda and naturopathy, and using that, I have seen many cases who were able to prevent the spread, and also who were able to treat themselves. Again, in general, when we look at the Ayurvedic medicine and naturopathy, we do not provide any treatment, especially Ayurveda, do not treat the disease. We treat the person. And when we're treating the person, we're trying to build upon their immune system. When their immune system is strong, then their body is able to fight against any foreign particle, virus, bacteria, parasite, or chemical, or anything which is entering the body to cause the disease. So why not we work on something which is proven to work? So what I've seen every day in the news, that we are talking about drugs or the vaccines or the respirators or the mask shortage, but nobody is talking about the natural resource which is given to us, our immune system. And no one talks about a good diet, a good food, something to boost immunity, something which is going to make our body healthy. So let's talk about that. So in Ayurvedic medicine, when it comes to treatment of a disease or a condition or a person, we look at 3 things: Ahar, Vihar, and Aushadhi. Ahar means diet, your food, what you eat. The old saying is, you are what you eat. So why not work on that part? If you are what you eat, then why not eat something good, something nutritious, something which is going to boost your immune system? The Vihar is a lifestyle, how we live our daily life, every day, season, the year, depending on where we are. So that is the Vihar. And in this case, again, when we look at the personal protective equipment or mask, is also a lifestyle at this point. We must change according to the circumstances. Washing hand, keeping personal hygiene is also Vihar. Aushadhi comes at the end. Aushadhi means medicine or supplements, whatever will work as a medicine, even though food is medicine if taken in proper quantity. And so we are working on these three principles of Ayurveda to boost our immune system. So let's look at the first principle of Ayurveda when we are talking about the health. What is health? So what Ayurveda says, and Sushruta Samhita, which is one of the ancient textbook of Ayurveda, it says samadosha, samagnishcha, samadhatu malkriya, prasanna atma indriyamana, swastha iti abhidhyate. So it is saying that samadosha, which means the balance in dosha. So there are three doshas which are fine, and most of you have heard me talking about those before, the principle or basic Ayurvedic information, talking about vata, pitta, and kapha. Vata, as we know, is the energy which controls the movement, circulation. And circulation could be the circulation of blood. We talk about the cardiovascular system, circulation of lymphatic system, very important. The circulation of motor and sensory pathways, which is the nervous system, the urinary system, basically the kidney function. So, and all the movement of food from mouth to anus. So whatever is moving inside the body is controlled by vata. So in this case, what we are looking at, that as long as our circulation system is strong, then we will have a good health, which means this also includes the circulation of air, the gas exchange. And this is what we are dealing with at this time when a person is not able to breathe oxygen or basically absorb oxygen from the lungs. If the lungs are inflamed, then of course that function will be compromised. So in this case, the vata, when we look at three doshas, vata is the one which will be controlling the circulation, including the respiration. Then we look at the pitta, which is the energy of transformation, which is basically metabolism, the heat, the agni. Agni is the heat. And again, we look at over and over, first thing we see when someone have a chronic disease, any chronic disease, their temperature will be less than normal. So when in general we think 98.6 is a normal body temperature at which body is able to perform all its normal functions, all the enzymes and hormones are released properly, and person stays healthy. When we see an individual with a low temperature, their hand and feet we find are freezing. Even in the summer, they feel cold. We know that either their adrenals are weak or thyroid is weak, and eventually when their entire body function is compromised, slowly becomes sluggish because of the low temperature. And that is the basically fire or agni or heat we look at. Beside that, we look at Jatragni, which is the digestive fire. So when you look at the digestive system, that is also will compromise, and based on our digestion, we will be using the metabolism or the metabolic forces, which will be again a base of how our body is transforming what we consume from one layer to the next layer. And that brings us to the samadhatu. There are 7 dhatus or 7 tissues in the body. First one is when we consume something, it is converted into, after, depending upon how strong our metabolism is converted into the body fluids. Again, as we know, about 70% of our body is fluids by nature or liquid by nature. So in this case, whatever we consume, depending upon our agni, it will be converted into body fluids, and depend upon that next agni, the fluids will be converted into or extracted into the blood, and from blood to tissues, tissues to fat, fat to bone, bone to bone marrow, and bone marrow to the genetic material. So those are the 7 dhatus. So some doshas, 3 doshas, samagni, which means all the agnis, and some dhatu, which is 7 dhatus, and malkriya. Malkriya is the excretory organs, excretion. It means when we have constipation, again, there have been so much studies done finding over 70% of US adult population is constipated. People do not even know that they're constipated. So it means when they're constipated, the fecal matter staying inside is fermented, and that fermentation produces toxic gases and produces inflammation in the gut. And considering that in mind, we will bring that again with the gut health later on. We keep that in mind that the excretion is important to make sure that the gut stays healthy, digestion stays healthy, and our metabolism stays healthy. Also calls prasanna atma indriya mana, which means prasanna means happy, the happy soul, happy sensory organs, and also the mana, the heart is happy. So when all these happiness is there, that is called the swastha, which means the health. So a healthy individual is that which have all these in balance. So now some of these which we can treat by eating healthy, by taking supplements, but some come internally. Prasanna atma indriya mana, the happiness which you create by yourself, by satisfaction with what you have. And also, so I'm finding at this time, the social distancing and also work from home is causing so much stress. We used to hear that the best place on earth is your home. And I've seen many, many individuals who are at home and stressed. So I have many friends who will call, I'm so depressed because I'm going nowhere, I'm sitting at home. Well, that's the best place. You are with your significant other, your spouse, husband, wife, and also with your family, children, extent, all people are together. So what else you want? Why not play, sing, do some dance, music, do something to create that happiness? So when you're not happy, you're worried about something that also will suppress your immune system. So what Ayurveda says, all these things can be achieved. And with that, we boost our immune system. And while we are boosting our immune system, definitely body will have the mechanism it needs to fight against any virus, any bacteria, any parasite, any disease. So that is the Ayurveda. Now we're looking at the naturopathic principle. So even though we look at the 6 basic principles of naturopathy, it's also saying that we believe in power of nature. And the healing power of nature is very important. Also, we're looking at the treat the whole person, not the disease or any personal condition. We were not born into pieces. We were not born, here's the heart, here's the leg, here's the brain, let's put them together. We are born as the entire person. So every organ is codependent on each other and supporting each other. So naturopathic medicine says basically we treat the whole person instead of pieces. Also, we're looking at the basically if we can't make anything better, at least don't damage it. So basically the first thing is make sure we do not do any more damage. So keeping that in mind, we'll believing in the power of nature or healing power of nature. Both Ayurveda and naturopathic medicine brings us to the same point, that since we are given the healing power within us, since the nature has given us thousands and thousands of herbs and plants and fruits and vegetables, so many natural things, why not believe in the healing power of nature and natural products to bring us health back and maintain our health? So there's no need in general to have outside resources. Those should be required only by those individuals who have become so weak and fragile that they are not able to support their own body, and then we require the outside support. Otherwise, we should be building upon. Other thing is, at this point, when we talk about the coronavirus, there's no known treatment. There's nothing proven. So why not bring something which has been proven over centuries, our own immune system? So let's do something and discuss about boosting the immune system. So we bring the principles of Ayurveda, the ahara first, the diet. So what we have known dealing with this virus for a few months now, that the heat helps, and some certain supplements which had been used in some studies in China have worked, especially vitamin C have been talked about a lot in the European studies and Chinese study, not much here, but again, diet should be the first one. So in considering the diet, we will also talk about the organ which will extract what we eat, the digestive system. So diet is very important and heat is important. So first principle we want to make, not to eat something or drink something which is very cold, no ice. So first defense mechanism we have is heat. And we have seen that over and over and over every day. I can assure you, every one of us have seen that. Anytime we have an external source causing a disease, any chemical, any bacteria, any biological source, or any environmental source, causing any kind of infection, the distress in the body, the first thing body does is raise temperature. We call it fever, because in the body knows, the brain knows that I can win this, I can defeat this organism or whatever is causing the disease by raising my temperature. So naturally, body raises temperature. We call it fever. So in general, what is found between 102 to 104 degrees Fahrenheit temperature, most of the viruses, bacteria, and parasites are destroyed. Even that principle is used in cancer treatment. Hyperthermia increase the temperature, and then cancers are also destroyed to some extent, even though many other factors play a role. So basically, at this point, the heat is important. So why not put something in this body which is going to support that principle, which means we start our day with a warm food. So first thing you put in your body is hot water, 1 cup, and the breakfast has to be hot, no cold cereals, please. And especially at this time, no ice cream, something cold, and also the fresh organic food. And most of individuals, most of us I've known, again, except few people like me or other people who have to go to work every day. Many are working from home. All the students are at home. All the teachers are at home. Many people who work in IT, they work from home. So why not use this opportunity to go to the kitchen together and then make a breakfast together, lunch together, dinner together, and make it a fun part. So get organic food, not in the can. We don't want to use chemicals, preservatives. Either fresh organic food, which will stay good for a week and a half, and then also use foods which are coming as frozen. Those you can keep in freezers for a long time. So everybody come to the kitchen, make a soup, chop things. So a lot of things which you can use in the daily soup. So for example, the onions in the soup have a lot of quercetin, which is anti-inflammatory, and a lot of flavonoids. The turmeric we can use, the fenugreek we can use, the cumin we can use. So a lot of spices we can use, which we'll talk also later. So make it a fun part and create enjoyment and have a good breakfast, lunch, and dinner freshly cooked. And if you want to go out to grab something, and many individuals who are not used to cooking, then instead of going to a chain restaurant where the food is coming from an unknown source, or we don't know where they're coming from, because mostly chains are at national level. Of course, they're in business to make money. Most of their food will come preserved from other parts of the world also. I have known personally many chains where their vegetable and food come in frozen packs from outside the country, and we don't know for how long that had been sitting there. And so that's good for them. But again, at this point, we want to be as much careful as possible. So we want to eat locally grown food from local vendors, local restaurant, local cafe. So at that point, we are not only supporting our local community, but also we know these people are one of us. They are cooking good food, fresh food, organically, locally grown food, which is going to support us. And that is what we need to use if you are not cooking at home. So make sure we use those resources instead of going to the national chains. Also, a lot of food with vitamin C. We have talked about vitamin C a lot. And again, everybody, every day, we do read a lot of literature about vitamin C. In some studies in China, higher doses of IV vitamin C have been used also, as much as 25 grams of vitamin C. But smaller dosage, multiple times, are good. Again, we will mostly focus on the plant-based diet, because not only is it easily digestible, it has fiber which also help our gut lining, easily available, and the best part is that it is going to nourish us. So broccoli found to be very high in vitamin C. Cauliflower have a lot of vitamin C. Kale have a lot of vitamin C. Sweet potatoes, bell peppers, fresh thyme is really loaded with vitamin C. We can use in cooking. Mustard, spinach, cooked is actually have a lot of vitamin C. So we want to make sure that we saute and cook them. Brussels sprouts, a lot of vitamin C. And of course, strawberries have a lot of vitamins. So you want to use the source which is naturally provided to us, and then we bring that and use that. So in the beginning, in the morning, we want to have a hot cup of soup or a chai. And you want to make chai with cardamom, which is really good for upper respiratory tracts. We want to make sure that your throat and lungs are clear. We want to put a little pinch of black pepper in there. We want to use cloves, which are antifungal. And also you want to use holy basil or tulsi, which is again it's a blessing for the lungs. So you want to put few leaves of that, and then dry ginger or just ginger, fresh ginger, grate that. And ginger is one herb which is known to be very helpful in this case. Not only is warming, it improves circulation, which is very important, also good for lung health. So we want to use, so basically you may want to drink a hot cup of chai in the morning, and later on your soup should be part of your breakfast. And again, if you want to put something room temperature, then the smoothie will come which have many of these things, and you may want to put some kale in your smoothie. You may want to put some blueberries or strawberries, and also some almonds. Nuts are really good. You may want to put a little bit of flaxseed to give you omegas, and just blend with some dates just to make it taste good. So that will be also good. We hear a lot about turmeric, which is one of the best source for inflammation, anti-inflammatory, antihistamine, and also really good antibacterial, antifungal. So why not have a hot cup of golden milk, where you can use the regular raw milk, or you can use the almond milk, rice milk, any kind of milk you take, and then you boil that with some turmeric, a little bit of black pepper because it requires an absorption, and you want to put saffron, really great for immune system. So have a good cup of golden milk for you and your family. But one thing I would like to bring into attention here, we're talking about diet, and all of us eat. So how much of that is absorbed? That makes a big difference. If it is not absorbed, then we're wasting majority of what we are consuming. So keeping that in mind, we need to pay some attention to our digestive system. So we know that this virus or any other virus enters our body through the mucous membrane. Nasal passageway is the port of entry. From there, it goes to the throat, where it stays for a few days. And then from there, it had two ways to enter. Either it can go to the lungs or to the gut, or both. In most cases, it goes to the both places. Only thing is, when it goes to the digestive system, we ignore in general, think, oh, it's only my gut, and we don't pay attention. Other thing is, there are many other factors which are protecting, especially the acid produced by the stomach, and the bile produced by the pancreas, by the liver, which is coming from our gallbladder, and the pancreatic enzymes. So there are so many other factors which are there to prevent us, will dilute to some extent, and try to take care of us as much as possible. So in that case, that will prolong the time frame where the virus is spread. So it has been found a person who have gut issues will take at least 9 days in general, or average of 9 days before the symptoms appear, compared to a person who have the mode of entry settling into the lungs, average about 7.3 days. So if your gut is intact, then that is also saving us to some extent. But in most cases, both organs are important. Hydration is very important. So make sure you keep drinking water, and try to get room temperature or hot water if possible. So hot water, you boil that with some ginger and cardamom, and that will also helpful in the keeping your throat clean. So if your throat is getting clean, the heat will kill the virus if it's very hot, but try to get more heat as much as possible. So there have been some studies done. And so the first place where it starts, Wuhan. So when you look at the Wuhan study, have been 2 studies done where we found, or the researchers found, that in both cases, majority of individuals who were reporting the disease, it started from their gut. Only thing is they were ignoring those cases. The first study had 204 cases. Out of those 204 cases, 103 actually reported they started only with the gut issues. Either they had diarrhea, or they were not feeling hungry at all, or they were vomiting. So 4 cases actually reported vomiting, and 35 had diarrhea. 81 of them reported they were not feeling hungry at all for days. And also, basically, there were many others who had a lot of pain. So 103 or 104 of them, just 103 just reported that. Other 97 reported both combination of the digestive issues and also combination of the lung issue. So respiration and the digestive issues both. But again, in those cases also, even though digestive issues were there, they were neglecting that and they were admitted to hospital when they were not able to breathe. So respiratory distress became an issue. In this study, there were very few cases, roughly 4 or 5 cases who just reported that they had basically only the issue with the gut. But again, one thing this study tells that individuals who were affected, their gut was affected the first, even though it was ignored. The second study, which was a little bigger study, had 850 cases. Out of 850 cases, the forward found majority of cases also were reporting that the disease started from their gut, even though they were ignoring it. The one thing which put them in hospital eventually was when they were not able to breathe, the respiratory stress. But again, the symptoms in the initial stage started from the gut issue. So in this case, what Chinese researchers have done, try to find the virus load or viral load in their fecal matter. So what was found, which I don't think that's doing that yet here, but with what was found in both of the studies, that the 73.3% of these affected individuals had a higher viral load in their fecal matter, whereas 14.3% had viral load higher in the other passage or lungs or the breath or the sneeze, which were without the digestive issues. So in this case, what is one thing we need to learn at this point? Digestive organ is the most important organ in this case, because most of the individuals are being affected in the gut, where it is ignored, because again, it is not one of the 3 vital organs, and we keep ignoring that. Anyone who starts seeing either loss of appetite, or they have severe diarrhea or abdominal pain, that could possibly be COVID-19, and we should be concerned about that. So let's talk about this also. The viral load, which the Chinese researchers have found, is 5 times more in the stool in affected individuals. So why not look at that part also? Other thing is, if we don't want to go to much of research because of limited time, but one thing it suggests us that the 25% of the population that we're looking at, when we take the stool sample, we're finding they have the positive virus or viral load in that one. Other things we need to be looking at, the gut immune function. In our immune system, gut plays a huge role. And it's a proven fact at this point, so we're talking about facts only, that 2/3 of our immune cells, or cells which build our immune system, are found in the gut and also the surrounding tissues. So when we know, as a matter of fact, a scientific proven fact, that the immune system is, majority of them is in our gut, and also the entire alimentary canal from mouth to anus is covered with mucous membrane. Also, we know at this point, this virus find its way through the mucous membrane, which is the nasal passageway, throat, and lungs, but also gut does also have mucous membrane. So it is going to the gut also, and from there is affecting our immune system. So why not we work on the gut as soon as we feel something, even though we don't feel something, keep the gut healthy. So the point I'm trying to bring here, that even though we are talking about the disease, there is no need to worry about that, no need to wait until we get the disease or we get infection. We need to make our digestive system strong and build our immune system, so that while we are building the digestive tract stronger and healthier, improving our immune system, we also need to study the gut-lung function, how we are connecting the gut to the lungs. And as we know, the lungs don't eat, heart doesn't eat, kidneys don't eat, brain doesn't eat. All of these organs are dependent on our gut for nutrition. So whatever we are eating is affecting them also. So if our immune system is compromised, if our immune system is weak, every other organ is also weak. So keeping that in mind, we need to make sure we also look at the sources which are going to support our gut lining and also our linings of the lungs, which is the mucous membrane. Then we talk about the vihara. So in the diet, one thing I would like to mention, basically not only hot food, but also easy to digest food. We, in Ayurveda, we use khichdi a lot, which is a combination of rice and lentils, mung beans, which are also, boosting immune system and also known to be found as preventing from many sicknesses, easy to digest, but also is all and found to be anti-tumor. So we look at the khichdi diet, and you can add different vegetables to that one. So you use those. Again, green leafy vegetable, colorful vegetable, vegetables which are locally grown, soups, smoothies, nothing cold, no ice cream, nothing from outside. If you want to eat vegetable, get the raw vegetable and chop yourself. Do not get pre-cut from outside, because we do not know who touched them, who sneezed on them, and where they have come from. So again, support local places, which you'll know they are our own people and they know what they're doing because they're one of us. And in that case, we can get a good food cooked by our own people who know us, and we not only supporting them, but also we get good nutrition through that one. And so in this case, when we look at the lifestyle, the first thing in lifestyle is social distancing, which we have been talking about. 6 feet, 10 feet, 11 feet farther we are, better we are, because as we are farther away from the source, the concentration will be less. Second thing I want to talk about, no smoking. Many individuals, again, I have not heard that in the news, but again, many individuals who are affected by this virus or viral load have issue with the lungs, they can't breathe. So when you are not able to breathe, then again, it means the lungs are at this point very, very important along with the digestive system. So this is a point or time where people who are smoking should considering quit smoking. So in general, when you're looking at the smokers, they have 1.4 times higher incidence or possibility of getting infection, and they have 2.4 times more possibility of being hooked on the respirator. So basically, they require more respirators or a outside source because their lungs are weak already by thick layers of smoking, depending on what they were smoking and for how long they've been smoking, and the combination of different things they've been smoking. Dependent upon that, the lining of the lungs or the alveolar sacs become very thick, and the absorption of the life force, the prana, becomes difficult. So we want to make sure that at this point, people who are smoking need to think with smoking. Personal hygiene is very important. Washing hand, not touching face, making sure that if you go outside, changing clothes. So that's our lifestyle. We put our hands into everything, playing outside on the ground, playing with the animals, playing our pets, and touching everything. And then, so that need to be controlled. And so personal hygiene, so that becomes, so sometimes a condition brings us a blessing. So this is a condition we think positively, going to change our habits a lot. And so in this case, when we talk about the personal or vihara, the lifestyle, we also talk about the Ayurvedic lifestyle, where we call it dincharya, the daily routine. So make sure after doing the daily task in the morning, what we do after getting up, we start our day with hot water or hot tea. Especially hot water is always good. So start with water, and then you want to have a hot tea, soup. So making sure, I'm not going to do a detail, we can talk about days of what we can do. So cardamom, tulsi, cinnamon, ginger, all these things, clove, those are all good. and take care of your agni. So digestive fire is very important. The metabolism very important. Most of us are staying home at this point. This is there is not much of movement, not much of exercise. Make sure you go for a daily walk and make it a routine. The whole family goes for a walk in the morning, goes in the evening, and make sure you, when you see your neighbors, don't go too close to them to say hello, talk, just shake hand. So we have seen namaste have become so popular during this COVID. People are not touching, not shaking hand, and everybody will say namaste, and I've seen that very popular. A beautiful thing, because in this case we are preventing the touch as much as possible. Nothing cold. So in this case, when you're looking at the dincharya, that also brings us to the daily routine where we talk about the pranayama. So in pranayama, there are different parts of pranayama, and you can see that on the screen. And many of you who are yogis and practice yoga every day, you know that already. And if you do not know, make sure you contact one of your local yoga studio. Many individuals I have known are offering yoga virtually nowadays on the Zoom. So you can practice yoga with their assistance and guidance at home. And pranayama, prana means life, ayama means taking in life force. So deep breathing, and there are different parts of it, different ways of it. You can learn those, but simple deep breathing is very important. That's the first thing. It will prevent our lungs from collapsing. So as long as we have we take a deep breath and a lot of air holding inside, increase your total lung capacity, then at least our lungs will be good. And depending upon how long we hold it, the stretchability of the membrane or the lining of the lungs will make it thin, and whatever is inside trapped will come out. So you want to make sure we absorb more oxygen and excrete carbon dioxide. So I'll not talk much about that, because again, we have so much to talk about. Yoga is also part of Vihara. So we have the Bhujangasana, the cobra pose, and all the cow pose, the camel pose, the bow. All these poses are given. Again, all these poses improve our metabolism and also improve our immunity. So like we mentioned, keep that in mind when we talk about metabolism, we talk about digestive system. When we talk about digestive system, we talk about immune system, because now we know as a fact, 2/3 of the immune system is in our gut. So when we talk about our gut, making the gut lining healthy, absorption better, and also any underlying condition in the gut, where it could be the inflammatory bowel disease, or where somebody have a leaky gut syndrome, and any of those conditions all require inflammation. We must do anything possible to reduce and remove inflammation from our gut. Based on that, every other organ will be supported. And then we look at the Surya Namaskar, very, very, very important. The 12 phases or poses of Surya Namaskar is very important. Not only we are doing a sun salute, but also spending some time in the sunlight, which is a great natural source of vitamin D. So basically our lifestyle need to be changed based on that. And then we talk about Aushadhi, or the herbs. So we can talk about all of these to an extent more detail, but since because of our limitation, we will go over these to provide as much knowledge as possible shared with you to stay healthy. So what we are using at this point is few herbs. Most of you who have had contact our clinic, they know that these herbs have been used and have been helping a lot of people. Amla extract. Amla is a gooseberry, Indian gooseberry, which is loaded with vitamin C. Estimates are that each amla fruit have about 20 times more vitamin C than orange. So why not use amla extract? This is even more potent. Giloy extract we're using, again, 2 capsules of each twice a day. Many of individuals are using that. Vasaplex and Immunitiplex are 2 combination of herbal decoction, which are there to boost our immune system by supporting the lungs. So lung health at this point, as we know, is very, very important. So with these, we also look at underlying condition. So basically, even though we talk about certain herbs, we also need to make sure if someone is diabetic, then what herbs to use or foods to include in their plan based on their condition of diabetes. If somebody have hypertension, we also have to make sure that we also treat and take care of their high blood pressure while we are supporting their immune system. If somebody have issue with the kidneys, we're also supporting kidneys, making sure the liver. So underlying conditions had to be seen also while we are trying to support and improve the immune system. So amla extract is used, giloy is used for increasing the immunity. With that, we're using Vasaplex and Immunitiplex to boost the immune system and also the lung health. Chyawanprash is a well-known herbal combination. It is basically a paste which is really rich in vitamin C, antioxidant. But again, we recommend individuals to use sugar-free if possible, because many individuals also had issue with the sugar. So even though with the sugar is commonly used, but try to find sugar-free if possible. Witheniaplex is also used a lot. Reason being, because of the way the environment is happening at this time, people are staying home, people are concerned about the economy, people are concerned about their health, people are concerned about social distancing, and many people don't have any of those concerns, but because they are staying home, cannot go outside or cannot go and eat outside, they're concerned for no reason actually. And so Witheniaplex and Complex have been used just to calm them down. And also Withenia is a adaptogen, helping these individuals adapt to the circumstances. So this is not in our hand. This is something natural. So only thing we can do is prevent any further damage and also stay away from the source and boost our immune system. So Witheniaplex have been used to boost the immunity by giving us a mechanism to cope with the stress, so anti-stress. Same thing with the Complex, many individuals who have insomnia because of the stress, they're not able to sleep. So with the Witheniaplex, we also giving them Complex, so giving them calm. Vitamin C, we have talked a lot. So basically, we like to go of the basic sources of vitamin C. Amla is there, and we look at all the herbs we have talked about. We talk about the diet, food of rich in vitamin C. So, or if not, then you can buy the vitamin C, but try to get from plant source will be easy absorbed. Vitamin C is a water-soluble vitamin, and in Chinese studies, we have found it has really being effective. So we need to use more and more to prevention also. If we take excessive, that will be flushed out through the kidneys because it's water soluble. Zinc found to be very, very useful. You can take 30 milligram to 60 milligram once or twice a day will be really good. Zinc, how I have found, is a Chinese combination of herbs, and they have used that in malaria treatment also, and they have used this combination in the treatment of COVID-19 also. So we keep that in our dispensary also to use for individuals who think they may have it. And again, there are some who will be positive, but they are afraid to go to hospital because they are serious cases, and they are concerned about getting other infections, bacterial or viral infection in the hospital, because hospitals have high concentration of patients. So in that case, they will come and they will take many of these combinations. Many individuals at this point have become so many, involved into research. They will come with the solution. Everybody is going over Dr. Google and study more and more and telling this thing is working, that thing is working. But we are going over only the proven facts which have shown improvement in the past, also to improve the immune system. In the Aushadhi, let's bring to spices, which have become part of the cultures, many cultures, and that is coming here also. Turmeric, for example, we talk about turmeric a lot. Turmeric is one of the best known antihistamine, anti-inflammatory, antiseptic, antibiotic. So anything you need, turmeric have been used. And that's why it's called the golden herb. So golden herb is not because the color is golden. It's golden because it can be used for anything. If there's nothing available, take turmeric. So depending on the anupana, depending on what is the source you take with, if you're taking with milk, if you're taking with black pepper, if you're taking with bromelain, if you're taking with ghee, if you're taking with oil, the carrier could be different, but it will show different effects based on what you combine with. So turmeric is number one, which you can take in golden milk, or you can just blend turmeric. Raw turmeric is available, make a paste with black pepper and ginger, take 1 teaspoon of that a couple of times a day will be really good. Ajwain seed or ajma seed, really good for digestive system. Like I said before, as we talk about anything which is going through the lungs or through the nose is affecting the mucous membrane, affecting our immune system. Again, in that case, affecting our digestive system. So supporting the digestive system is very important, and that's where the ajma seeds come. About 1/4 of teaspoon, boil that in 1 cup of water, make a tea, will be very useful. Ginger is also, we talk about a lot, ginger, garlic, cinnamon is really good, especially for individuals who have diabetes and issue with the sugar imbalance. Same thing with the fenugreek. So cinnamon and fenugreek will be really good. Make as a tea, or they can make it a fenugreek powder to sprinkle over their food and also put in the tea. So that'll be good. Saffron, cardamom is really great herb for the upper respiratory tract. Again, you can put that in the tea while you are making ginger, ajma seed, the cardamom tea, clove tea. Put a couple of cloves. Do not put so much clove because clove is very potent, is antifungal, really great for individuals who have lung infections. Commonly, they get flu, common cold very frequently. It means they have possibility of growing fungus in their lungs also. People are have concerned about mold, so make sure the clove is used. Thyme is very powerful, use that. So all these could be used in tea, in your milk, in your curry, in your rice, anything you're cooking, use these spices. That will be very, very useful. When we talk about the daily routine, there comes a time when we have to depend upon the external sources to support our lungs. So in Ayurvedic medicine, we look at different therapies, and one of those therapies, Svedana. Svedana basically means sweat. So you are sitting in a steam cabinet. The goal is to raise your body temperature. I mentioned earlier that if we raise our temperature to 102 to 104, our body heat is able to fight off the infection or the virus or bacteria. In this case, we're dealing with virus, so why not raise the temperature? If that is not, if you don't have the steam cabinet, get blankets, so sweat. So, but try to get sweat by wet heat, not the dry heat if possible. So, because many individuals who have issue with the lungs, the dryness or dry heat will cause problem there. So that's why we always recommend the steam or steam sauna, steam heat. So in the clinical setting, we use Svedana with ozone. So ozone provides the, again, ozone is absorbed through the skin. Skin being the largest organ absorbs more ozone. Again, ozone should not be inhaled. And many individuals who will buy ozonizer, everything is available online. Make sure you do not run an ozone machine in your home because ozone should not be inhaled. It can burn and damage the lungs. It should be used, it is used in generally to clean the homes for the mold, or also for any when there's a burn or anything, a fire smell, but you should not be in that house for at least 24 hours to 3 days. Make sure you open windows. In the clinical setting, when we are using the ozone, the neck is outside, so we make sure you don't inhale ozone. So ozone therapy with steam is used frequently, and that's what we are using. So in this case, we have gone over the route where it comes from. We have gone over what is there to prevent. Even though we were told over and over, we know there is no medication or there's no treatment, but there are ways to prevent yourself, prevent your family, prevent your friends and significant others, your neighbors, by keeping the distance, by making sure you wear gloves, you are washing your hand, and also these food, which is the most important thing we consume always. Make sure you consume things which are providing us good nutrition, boosting immune system, making sure that our Vihar, our lifestyle is also supporting. We all also want to make sure that we use spices every day to boost our immune system and also improve our gut lining and to poor digestion. Also, if you need, we also use some therapies. All these combinations you can use. If you need assistance, you should contact a trained Ayurvedic or naturopathic physician who knows these things, or you can call our clinic. We are there every day to support you. Again, thank you very much for joining. I hope it was useful. Any questions you may have, we will be taking those questions, even though we just took a little extra time. But again, I'm sure that was useful. And I'm open for the questions now.
We do have a couple questions already set for you. First question was, doesn't cooking food destroy vitamins? For example, how much does cooking broccoli or kale, etc., destroy the vitamin C?
So in general, some vitamins are actually enhanced and become digestible with the heat. So there are pros and cons. One thing is, if you don't cook them, okay, let's see. If you cook them, then we do damage 10 to 20%, in some cases 10 to 30% of the nutrients. So we get 70%. On the other hand, if you don't cook, there is a cold food, and our digestive tract requires heat. So many enzymes and hormones, especially digestive enzymes, are released based on a specific temperature. So if we have 100% of nutrients available in raw food, and especially the food which is not chewed properly. So many of us do not even chew food properly. We have 32 teeth in our mouth. If we give every tooth a chance to chew, then we are okay. Until whatever is put in the mouth is chewed properly and become like a paste, we should not swallow it. And that is where smoothies became popular. Saliva plays an important role. So while we make smoothies, we are bypassing the saliva. So unless we not drink smoothie, take sip by sip, or even water sip by sip, saliva is very important. So chewing actually is a better way. But in cold food, when we don't chew well, then there's nothing in the digestive tract to increase the heat which is required. So we have a pros and cons. Heating will release all the digestive enzymes which we do require, which will make that 70% of nutrients left easily absorbable. Otherwise, without that, we can't absorb them either. So now we choose what is better. I think heat is a better thing, because at least whatever is there left in the nutrients in the food, that will be easily absorbable.
Next question, will organic powdered turmeric and ginger, etc., have the same benefit as fresh?
Isha, can you speak up, or Dr. Kaushik, can you please repeat the question?
So question is, if the raw organic powdered turmeric and ginger have the same benefits as fresh. The most of the time when we find the organic dried, they are dried, and depending on the source. So if usually when they dry, they do not dry them outside in the sunlight. There are ways to dry them, and when the source is good, they dry them in a proper environment where they don't have mold and fungus growing on them, and then they are very potent. And most of the time when the herbs are dried, they are dried after they have become matured, which means they have fully ripened. So when ginger fresh is used, you will see most of the time the fresh ginger is very potent. It has not matured completely. Even though after drying, we will lose some of the potency, but we will gain other potency because now it's more matured. It will have the fiber. We can't chew that ginger at this point. So that is the more mature, ripened ginger, which is more potent than what we're finding in the raw form. But now as it's drying, it will lose some potency, but again, in the both, and it is the same. Absolutely.
Okay, great. Thank you. Those were Teresa's questions. Thank you, Teresa, for your questions. Next, from Ms. Nicole. She said, hi, Dr. Kaushik. Thank you for this talk.
Hello.
I have a few questions. First one being, neurological symptoms being found, such as anosmia, do you think the virus is directly infecting the neurons, or rather, do you think symptoms are being caused secondarily through inflammation of nerves?
Both, basically, depending on the patient. If someone have weakness, then they will affect. But so when we study the immune system, we also know that the gut-brain barrier, gut-brain connection. So we find neurons in the gut also. So the gut is connected with the nervous system also. So in this case, when there are individuals who have issues, it is going into the mucous membrane, and from there, not only it is affecting the immune system, it is also affecting the nervous system. And so basically, they, again, depending on the individual, some individuals who easily will become nervous or depressed or distressed because their nervous system is basically not as strong to begin with. And in that case, we do provide them, we make sure that we support them by giving Withania Plex to give them capability to fight or control their anxiety, and plus give them other things, the Bacopa complex, which is there to boost their nervous system. So there are many supplements which are provided. So that is the reason I mentioned any condition individual may have that will also change the pattern, how this virus is affecting, how it is transmitting, how it is showing as a symptom. So yes, that has been seen. So in that case, we want to make sure we go to the source. The first one is the gut, because that's where we not only find the virus, we also find the immune system, we also find the nervous system, the neurons in the gut.
Okay, next question. Have you heard of nebulizing colloidal silver in the treatment or prevention of COVID?
Yes, we have heard that. Many naturopathic physicians have been using that. So basically, it is supporting the lungs, boosting the immune system, and have seen good results. So many of these, I will say, have shown improvement and have shown good thing. But again, we will not claim any of these as a treatment. If somebody gets really sick and breathe, you need to go to the nearest hospital and get the medical care. But yes, it has been shown good results.
Great. Next question was, what is your suggested vitamin C dose?
Vitamin C, basically, there have been so much variety. So in generally, we take 2 to 6 grams a day in divided dosage. So some cases you can take 6 grams actually twice a day. But again, we recommend small dosage multiple times. So you take 2 grams or 2000 milligrams 3 times a day will be a good source where body is able to absorb it. And so we can maximize the use of vitamin C. If we take higher dosage and body is not able to absorb, then we're excreting most of it through urine or kidneys. So why not take small dosage and absorb most of it?
Next question.
Thank you.
Thank you.
She would like to know what you think of aloe.
Aloe is a good thing. Basically, we're looking at the aloe as a source of protecting the liver. So we always use aloe with the liver health. And even if you remember from the first few slides, we were also mentioning about the liver health. Many individuals who have compromised liver also affecting the production of bile. And as we are affecting the production of bile, the remaining metabolism is also compromised. So aloe is used, which is very important, have shown good result in boosting the breakdown of fats and also in the liver health. And so doing so, it is also providing good immune system or strengthening of the immune system. So good results. Thank you.
Next question. Do you recommend Sambucus elderberry to boost the immune system?
Many elderberries, again, we have seen many results, but again, in my research, I I found all the berries have antioxidant, but not much specific about this type of berry, basically. But all berries we see, especially when we find the organic one, all berries, again, we know are boosting the immune system because of the antioxidant properties. So keeping that in mind, so depending on the berries you find, more or less, they are good source of vitamin C. They also are good source of antioxidant, and any antioxidant will boost the immune system. So they will help. So main thing at this point to learn, we try to find a good source of berries from organic and also, again, as much local as possibly can. Thank you.
Next question. Does the microwave used to warm food change the nutrients?
Absolutely. There have been so many studies done. So microwaves will enter and change the genetic material or genetic code, or you can say DNA, or whatever you are putting inside, especially the proteins. So we are a society where we are concentrated about the protein. Proteins are denatured as the waves pass through the protein, and as the waves passing through, the denatured protein becomes toxic. So we should not use microwaves. Microwaves at one point became so popular. So if you have to use microwave, it has to be only for emergencies, like you're coming in your home at 2 a.m. in the morning and you're too lazy and too much work to turn on the heater or your stove, and you don't want many pans and pots to be dirty. Well, at emergency, you may want to use microwave, but not for daily routine. I've seen people who will use microwave for warming food on a frequent basis. So there have been many studies were found that the use of microwave will not only interfere with the electromagnetic waves of the body. So our electromagnetic waves of the brain and the heart are very sensitive, and the microwave is very powerful. So that will affect our brain function and our immune system because of the potency of the microwave is much, much higher than we are able to handle.
Thank you. Have you heard of elderberry being contraindicated for COVID due to complications arising from the cytokine storm?
In some cases, but again, in those individuals, they always had other issues also. So if they have underlying condition, then you don't want to use them. If they have no underlying condition, again, they will boost. But again, if somebody already have a compromised immune system or had issue with the breathing, then of course the cytokine storm will cause more problem because again, body is trying to prevent, again, the lungs are not able to handle the stress itself. So always, basically, when we talk about any disease, especially this one where there's no treatment, we always look at the underlying condition and then make a plan based on what is already there in the body.
Great, okay. The next question is, vitamin C and zinc are hard to find. What are some alternatives?
So basically, when we're looking at the vitamin C source, we're looking at the amla is easily available. Amla extracts are easily available. Amla juice is available. Amla powder is available. So that is one thing. And the dried orange peel is also a good source. So when we're looking at the amla, which has both, it has vitamin C and also have vitamins, also have zinc. So that's why we mentioned amla in the beginning. It is one of the fruit which has both things together. Other thing is you may want to use a combination which is very popular in Ayurvedic medicine, or people who follow Ayurvedic lifestyle is Chyawanprash, and that's also, you'll find both. Not only you find both, but also a good concentration, but plant-based completely and easily absorbable. So the reason we keep promoting the plant-based, because the fibers, not only getting nutrients, but the fibers also keep the gut health healthier, also reduce inflammation, and also easily absorbable. Whereas when we get the source is a chemical based, then body does not absorb completely. So that's why we keep talking about the plant-based diet.
Is quercetin a good alternative?
Quercetin is a good alternative, and but again, quercetin is basically looking at the flavonoids. So even though flavonoids are also anti-inflammatory, we find a lot of that in onion. We find a lot of in the supplements which also have vitamin C. But we cannot use, so it's anti-inflammatory, but not as potent source as vitamin C. In fact, if somebody is trying to boost their immune system, they should be using vitamin C with the quercetin both together to boost the immune system. So in that case, if there is nothing available, is a good anti-inflammatory, yes, you can use that. But again, vitamin C find is a little more useful if possible.
Thank you. What form of zinc is best?
We're finding many sources of zinc and the plant-based diet. but again, easily available. You're finding a lot of zinc, either powder or capsule, because one thing in the capsule, they're easily absorbable. There are many capsules available which are made of veggie capsules, so the rice capsules which are easily absorbed. But when we looking at the plant-based, that probably will be a good source. But again, and the capsule form will be much better. There are zinc available which are absorbed in your mouth as you spray, and that could also be used. So other sources you can use, or most of the seeds also will have those. Pumpkin seed is a good source. So many of the seeds which you find, nuts will have a lot of zinc also, so that will be a good source also. So make sure you make a good use of nuts, make a paste, make a dip, or put them in your food. That'll be also good source. Other things I was thinking, the sesame seed will be a really good source. So sesame seed will be really good to use that also.
Does heating almond milk affect the nutrients?
If you are heating them for a long period of time, all the nutrients are affected by heat. But again, like I said before, heat is also required for absorption. So if you are heating them in microwave, of course, you are damaging them, because almonds have a lot of protein. We don't want to denature the protein. But if you are making a paste, or you are grinding them, and then you have boil your milk or other source, and then you are mixing the powder, then it will not damage anything inside in your almond, and in fact will make it easier to absorb, because you are providing the number one thing which your body need, agni, the heat, the metabolic fire. You're supporting that, providing heat, so it will be useful.
Okay, great. Next question. If you have already had COVID-19, what is the possibility of getting it again this season?
Depending on your immune system, that's one thing. So individuals in general, before, we used to think that your body will produce antibodies, and when you have antibodies, it will fight against it, and your body will be able to you'd be able to defend and basically protect you. But there are many individuals who are immunocompromised, or their immune system is suppressed, and they have many underlying conditions, and in that case, it has been seen in case of COVID that it can affect again. And there have been cases when they were infected and they were reinfected. So we cannot just assume, well, I've already been infected, so I have antibodies and I'm safe. I've seen many people saying that, oh, I've been done once, I'm over. No, you're not over yet. So we don't know how long it will stay. It is uncertainty. So when you're dealing with uncertain things, don't gamble. Only thing we know, that anytime we are able to win a race against, or win a fight against any disease or condition or any organism, when our own body, our own immune system is strong, so which is given to us naturally, build on that and you'll be safe. But don't get yourself knowingly into a condition that I am safe and it won't touch me again. There have been cases which have been reinfected.
You mentioned aloe is good for the liver. How do you recommend using it? In what form and at what dosage?
So aloe is coming in different form. Powder is available. Is recommended 3 to 6 grams twice a day. So you take 3 grams with mixed in water, or just with water. 1 teaspoon in the morning, 1 teaspoon in the evening. There are capsules available. Capsules coming in the gel form. You take 2 to 3 capsules 2 to 3 times a day. So roughly about 6 capsules a day is recommended. And now there are juices available where they take the pulp and put in a bottle. You take a tablespoon twice a day. So there are many sources available. So powder, 3 to 6 grams, capsules, about 6 capsules a day, divided dosage, and also the liquid form, which is the juice, 1 tablespoon is recommended twice a day.
Next question is, what are good sources of vitamin D3? Is it a good supplement to take on a daily basis? If so, what dosage?
So vitamin D depends on, most of people nowadays are deficient. We have become an indoor society. So in some cases, we used to assume that people coming from some countries are more outdoor. People with the dark skin or with Zoom, they have a good amount of vitamin D. Not the case. Most of us now have become indoor society. Air conditioning is available everywhere. People have fans. And the best or the worst thing is the television, which is everywhere. So people are inside even now when they are free, and there is excuse of not going outside in the sunlight, staying inside watching their popular show or working on the computers. So this is a age where we spend mostly our inside. So the plant-based green leafy vegetables are good source. Mostly lentils and mostly nuts have a lot of vitamin D. We are finding the sesame seed have a lot of vitamin D. So those are but again, the best source is the nature. When you are spending basically 30 minutes to an hour outside in the sunlight, exposing at least 30% of your body, which means the skin. So that was one thing with the Surya Namaskar. The reason all these 12 poses are there, so you do spend about 30 minutes in the sunlight, facing the sun, early morning when the sun is coming out, and evening when the sun is going down, not in the bright sunlight when is the peak, not in the heat. So when it's mild, and exposing about 30% of your skin, 30 minutes at least, will give you enough vitamin D. But since most of us don't do that or do not, or have some excuse, a good excuse to do not to do that, then we take, dependent upon how low we are. But I'm saying so vitamin D3, I recommend mostly vegetarian or vegan, plant-based. Reason being that fish used to be a great source, and until about 15, 20 years ago, we were recommending a lot of fish oil and the fish-based, but fish had been contaminated all over the world with mercury and other toxins. So now we are dependent upon just the plant-based. 5,000 IUs will be a good dosage until your level comes to a normal one. I would like to see roughly about 50, even though we find literature saying that 40 to 100 is a good amount. But when you look at about 50 or so, they'll be good. So until then, if it's too low, and then you take a higher dosage, 5,000 IUs. Otherwise, you support yourself 1,000 IUs once or twice a day until your level is high, but again, for 3 months at least.
Next question is, what brand of vitamin C would you recommend?
I am not here to recommend any particular brand. So there are so many good ones, but I have seen, worked with many, nutraceuticals. They are good ones. When we use that, like I said, I use the plant-based. So I use the amla extract, which is coming from a good source. I use Vedic nutrients. Vedic nutrients is right locally here. And I also use Shri Sai nutrients. We also use Ayush herbs. We also use Benin botanicals. And then when we're looking at the vitamin C, we look at many sources of vitamin C I have used in my practice. Vitamin C with bioflavonoids, which is made by Vital Nutrients. I also use with pure encapsulation. And I'll also use something from, this is coming from Allergy Research Group. I also use something with integrated therapeutics. So there are many good companies, but in my practice, I use these few which have provide good source of vitamin C. But I use vitamin C either with amla or bioflavonoids.
Next question, would you recommend using almond milk with coffee in place of sugar or creams?
Well, sugar and cream are two different things. So sugar should not be used at all anyway. So in that case, I don't recommend putting sugar at all. But if somebody likes to put sugar, I like to recommend stevia, which is the pure plant-based and have no glycemic index. Then we use the agave. Then I use jaggery. But if it's not the tea or coffee, then I'm a big fan of dates. So you chop dates and then mix that with your rice pudding or your dessert. And honey should be used only when you are not baking it. Honey have a lot of enzymes, and baking enzymes is going to denature them also, and that will make it toxic. So honey should not be used. So that is about the sweet. Yes, I do recommend that when you are using any thing to in your coffee, when it comes to the milk, then the almond milk will be a good source, a better source. So you should use almond milk instead of the regular milk. But people who are dependent upon the milk is still a beverage or drink used all over the world. Then you look for organic and go to a local farm if you can find one. So local farms, the farmers, then you will know that many of them are not giving anything to their cows, no enzymes, no chemicals, no injections. So in that case, you'll find a good source of milk, but almond will be a good source. Other things I like to mention, many of us use different form of fat. Ghee have been coming as a really good source of fat. So use ghee, use natural oils, which means the sesame seed oil, the almond oil, the olive oil, so mustard oil. So not the combination which you can't tell. I've seen many with the frozen things like Crisco or so, or vegetable oils, which is blend of so many things you can't even recognize what is in there. So find a good source of fat which should be used.
And then one last question that we have actually verbally. Galaxy A10E has their hand up. If we can unmute him, please.
Sorry, which one?
Galaxy A10E has his hand up.
Yes, that's me. That's
okay.
Can you hear me?
Yes.
Yes.
My question is, I came in very late. I thought this began at 7. Is there any way that I could get this on a recording?
Library should have some resources. They may replay it. So please contact the Tuckahoe Library, and their staff is there, so they should be able to help. So
Okay.
Thank you, and thank you for joining, and thank you library and all the staff for providing this opportunity. I'm still here in case you have any questions.
I think there's still one more question. Like, any suggestion for you to buy fresh ginger?
Any suggestion to find?
Any suggestion where to buy fresh ginger?
Most of the local stores are keep ginger nowadays. I've seen many local organic stores where I have my office in Cross River, Nature's Temptation. I've seen have ginger. So many of these places which you will find locally have. Many ethnic stores will have a lot of ginger because people from Asian countries use a lot of ginger, and so that'll be good. But you'll find good organic from a good source. I think Whole Foods also. So many places they say this is a herb which is used so frequently nowadays. So we order from different organic stores. Actually, at this point we are using maybe 4 or 5 pounds a week. It's like everything we cook have a lot of ginger. Reason being, I see patients every day. My wife is also a naturopathy doctor. She see patients every day. My both daughters are in naturopathic school. They see patients every day. So my son is also in the same profession. So entire family is working with individuals. We do not know who have the symptom, who is sick. They come for help. So we have to make sure we take care of ourselves also and prevent others also. So in that case, ginger has been a blessing. Everything we cook have a lot of ginger. But ginger powders are also available. So at our clinic, we do keep ginger powder because many patients are not able to find the raw fresh herb, or they don't have access, or the stores are too far, or for some reason they don't have transportation. And for that reason, we do keep organic potent powders of these herbs in case people need them.
Okay, thank you, Dr. Kaushik. I feel so very fortunate that you give us this like very educated and informative section. I have a friend who suggests me like when I go outside, besides wearing mask, I should have some like make some ginger slices and put in my mouth. I don't know if that worked, but I have been doing it when I go outside. So I also want to thank everyone for your question, like is sharing your question, and so we get like a very good questions during the sections. After the program, we are going to send out a survey to everyone, so please fill out the survey if you can. And we were thinking about maybe in the future, if everyone wants to have more program related to this series, and then we can have more program coming up. So please spend a minute or two, just fill out the survey for us. All right. Thank you very much, Dr. Kaushik. Yeah, and then your assistants as well. They are doing very good job.
Yes,
Yes.
indeed. We don't have to do this one. But thank you again. Thank you for having me.